Hi all. Hi all. Today we are going to see about childhood development. In that we are going to see about prenatal developmental stages. Okay, prenatal developmental stages. There are three main stages in prenatal developmental stages. First is germinal stage, embryonic stage, fetal stage. In germinal stage, it starts from the fertilization to 2 weeks. During the germinal stage, from fertilization to about 2 weeks, a gestation age, the zygote divides, become more complex and it's implanted in the wall of the uterus. During this fertilization stage, the sperm and the egg will divide into zygote and it will fit in the wall of the uterus. Next is embryonic stage. This is the second stage where it starts from 2 to 8 weeks. During the embryonic stage, the second stage of gestation, from about 2 to 8 weeks, the organs and major body system like respiratory system, like lungs, digestive system and nervous system develop rapidly. During this 2 to 8 weeks, the baby's respiratory system like lungs, heart, everything will start developing rapidly. This is a critical period when the embryo is most vulnerable to destructive influences in prenatal environment. The most severely defective embryos usually do not survive beyond the first trimester. The first trimester is nothing but till three months, okay, or the third month of pregnancy. A spontaneous abortion, commonly called a miscarriage. During this period, there are many chances to get a miscarriage because of some reasons. Maybe it can be because of some developmental issues, or it can be because of any environmental causes. Okay, next is fetal stage. Fetal stage is 8 weeks to birth. The appearance of the first bone cell at about 8 weeks signals the beginning of the real fetal stage. The final stage of gestation. During the period, the fetus grows rapidly up to about 20 minutes in previous length, and the organs and the body system becomes more complex right up to birth. Final details such as fingernails, toenails, heads continue to develop. Okay, during this period, every organs will start to develop quickly, and in this period the growth will be 20 times rapid than the other stages. Okay, for example, the hairs, nails, skins, everything will start begin during this time and it will be rapid. Okay, next is prenatal risks. Prenatal risk is nothing but if a woman is pregnant, he or she will have some risk. It can be whether mentally or physically, or it can be anything. Okay, prenatal risk refers to a factor that can harm the developing baby fetus before birth. Okay, it will affect both the mother and the child. These risks can affect the baby's physical health, brain development, and causes birth defects, miscarriage, and low birth weight. Low birth weight is nothing but premature birth. Okay, there are many reasons why this prenatal risk is happening. First is genetic risk. For example, if a mother or a father, or if a grandmother or grandparents is having some genetic issues like any blindness, or anything handicap or anything, it will affect. Sometimes it will affect the baby too. Next is environmental risks like sounds from the environment, or some other things. Okay, maternal health risk is nothing but it is very important for the baby to grow inside the fetus, because if the mother is happy, then the child will also be happy inside the womb. If the mother is not happy, or if she is having any other mental issues or physical issues, it will affect the child also. Okay, next is lifestyle and emotional stress. Like if the mother is having any high stress or domestic violence, or poor mental health during pregnancy, as I said before, it can also affect the fetus. Okay, age related risks like teen pregnancies, like 18, 19. If a woman is getting pregnant in 18, it will affect the baby in some other ways. Okay, next is or late pregnancy after 35. Okay, it will lead to some miscarriage or some other issues. Okay, that is like premature birth, miscarriage, chromosomal abnormalities. Okay, Next is how we can um, how we can like protect these problems. Okay, first is early detection. If you are going, if a woman is getting pregnant or got pregnant, he or she should she should consult the doctor monthly. She should get the regular checkup from the doctor to know how the baby is growing inside, and how is there any issues for the baby or for the fetus. Okay, next is health education. They should get health education, like how they should be in the pregnancy period. Next is improved outcome. What are the outcomes will they get if they followed all these? Okay, like getting a health checkup or getting health educations, all. Okay, all these matters for a pregnant woman. Common, what are the common birth problems? First is neural tube infection, like spina bifida, where the spine is not closed properly. This is a one problem where this kind spine is not closed properly. Down syndrome is nothing but the baby will have only 21 chromosomes. Okay, next is congenital heart problem. This is nothing but some issues in the heart, structure of the heart. Okay. Next is interuterine growth restriction. The baby grows smaller, slower than normal inside the womb. The baby won't be growing normally, and it won't have the proper development. For example, if a baby should develop for example, if a baby should be developed respiratory or digestive system should be developed within 3 months. If the baby is not getting developed, then that baby is having some issues. Okay, thank you. Next is, what are the causes of these birth problems? Maybe, as I already told, it can be because of genetic abnormalities, or it can be because of maternal infections, or if the mother is getting some infection, like because of smoking or drinking, it will affect the baby also. Next is poor maternal nutrition. If the mother is not taking a proper foods, nutritious food, it will also affect the baby. Exposure to harmful substance like alcohols, drugs, or any other UV rays. Okay, uncontrolled diabetes. If the mother is having thyroid, sugar, BP, it will also affect the baby. How we can prevent this? For preventing this, the women should that pregnant lady should go to regular checkups, should take folic acid supplement like iron, calcium tablets. Okay, avoiding harmful substances like smoking, drinking. Okay, all these, managing maternal health, mental health conditions. Okay, these will avoid these birth problems.